Be warned, you risk a 20,000 shilling fine should you be found in public places or in a vehicle, whether private or public, without a face mask. New rules published by the Health Cabinet Secretary Mutahi Kagwe also makes it illegal for drivers to carry passengers more than 50% of the vehicle's capacity. But in the midst of a face mask craze, there is no assurance that your cloth masks or homemade masks can protect you from the virus. Sam Gitoko reports.
It's now no longer an advisory but a requirement for any person in Kenya to put on a face mask while moving from home. This is contained in new rules to guide preventive measures against COVID-19 published by Health CS Mutahi Kagwe. For travelers using public or private vehicles, they must put on a mask covering the mouth and the nose. Failure to do so, they risk a fine of up to 20,000 shillings or imprisonment of up to 6 months or both should they be convicted. Beyond the masks, all vehicles will now be required to carry not more than half of their licensed capacity. For a saloon car or 5-seater capacity, for instance, not more than 2 passengers should board. Bicycles will no longer be allowed to ferry passengers, a blow to boda operators who use bicycles. For tuk-tuk operators, they may carry goods, but when they choose to ferry passengers, it can only be 1 passenger at a time. Those who flout the rules will face a similar penalty of 20,000 shillings or 6 months imprisonment. With thousands of Kenyans concerned of the source and price of face masks, many have resorted to cloth masks that are more durable given reusability, but that may not be an assurance of protection. According to the Kenya Bureau of Standards, there is no standard to measure quality of cloth masks at the moment. But KEBS advises that a cloth mask should have double layer of fabric and in between a filter layer be sewn. Such a mask should be washed with soap and water. But the statement from KEBS and Ministry of Health indicating that cloth masks offer limited protection against droplets and that they have no guarantee against COVID-19. The Ministry of Health, however, is still advising use of the masks.
Even though we may not be able to have evidence, but because we are dealing with a formidable opponent, it is better to deploy even the cloth masks to be able to protect our people as we develop the standards going forward.
The safest bet as of now being surgical masks that have 3 layers. According to KEBS regulations, a standard surgical mask should have the outer layers made of cotton and polyester, while the mid layer is made of polypropylene. Such a mask has a bacterial filtration efficiency of 98% per minute, appropriate for health workers and patients with infectious diseases. The outermost layer should not absorb water if it is to meet the standards. Aware of an increased demand for the surgical masks, KEBS and the Ministry of Health are calling on Kenyans to reserve the masks for healthcare workers, saying they are in limited supply. Most surgical masks are blue in color, the outer layer of a darker shade than the inner one. The in-between layer is usually white in color. Some of the masks in the market are only useful in protecting the user against dust, with minimal value in keeping the virus at bay. The Kenya Bureau of Standards saying it's willing to assist Kenyan tailors attain required standards for COVID-19 protective masks. Sam Gitoko, TV, Nairobi.